Good afternoon, everyone. The title of the study is Respiratory Syncytial Virus Lethality, a 16 years experience in Buenos Aires Children's Hospital. In Argentina, respiratory viruses are the third cause of death in children under 5 years of age. Respiratory syncytial virus is the main agent that causes acute lower respiratory tract infection in children. Active epidemiological surveillance is an important tool to assess the impact of respiratory viruses in a pediatric population. The aim of this study was to describe the lethality factors associated to RSV infection. We performed a cross-sectional prospective study of patients admitted for acute lower respiratory tract infection between 2000 and 2015. We performed an active epidemiological surveillance with a specific case reporting form. We included all patients admitted for acute lower respiratory tract infection, the virological diagnosis of respiratory viruses, RSV, adenovirus, influenza virus, and parainfluenza virus were detected by fluorescent antibody assay and real-time PCR for influenza virus. We use a PINFO7 program to analyze data and SPSS program for the multivariate analysis. Well, in this pie chart, you can see our population of from a total of 14,044 patients included in our study. 84% of them were tested for respiratory viruses, and 45% of the samples resulted positive, being RSV predominant all through the study period with an 81%. It was followed by influenza virus, parainfluenza virus, and adenovirus in a lower percentage. In this chart, we can see that RSV showed a seasonal epidemic pattern with viral activity onset and offset in the 19th and 35 epidemiological weeks, coinciding with the months of lower average temperature and higher relative humidity. In this chart, I want to show you the description of the RSV population comparing non-fatal with fatal RSV cases. First of all, fatal cases seem to be younger, with a median of age of 5 months against 7 months of non-fatal cases. We found no gender difference. Fatal cases where they were more frequently born preterm, with neonatal respiratory pathology, immunosuppressed, malnourished, 20% against 4.8%. Almost half of fatal cases had previous admissions for respiratory causes. 2/3 of fatal cases had underlying diseases, being the most frequent chronic respiratory disease, congenital heart disease, and chronic neurological disease, and almost all of them had complications during hospitalization, being the most frequent respiratory distress and sepsis. The most common clinical presentation for fatal cases was pneumonia, and the nosocomial, almost half of fatal cases had nosocomial infections. The lethality rate was 1.9%, 80 patients died. When we made the univariate analysis, we found that pneumonia as clinical presentation, readmission for the same episode, the presence of immunosuppression, neonatal respiratory pathology, congenital heart disease, chronic respiratory disease, and chronic neurological disease were associated with lethality. But when we made the multivariate analysis, we found that malnourishment, congenital heart disease, and chronic neurological disease were the independent predictors. To conclude, RSV infection showed an epidemic pattern from May to July and affected mostly young children. RSV lethality was more associated with malnourishment, congenital cardiopathy, and chronic neurological disease. Thank you.
Thank you for that very nice presentation. I was just wondering whether you could shed some light on what grade of malnutrition was the risk factor, whether was it any malnutrition or moderate malnutrition or severe malnutrition?
Moderate to severe malnutrition.
Thank you. When you look at the cases that had pneumonia with RSV, do you have a sense of how many or what proportion of those had a bacterial etiology isolated from the blood or a diagnosis made somehow?
We didn't study co-infections because it was not the aim of this study, but we have data of blood cultures and also viral co-infections, especially in the recent years when molecular techniques began to be used at our center. But I don't have that number here.
James.
Oh, yes. Thank you. Could you expand a little bit more on what you mean by nosocomial infection? So you said that 50% of those that died had a nosocomial infection.
Yes, we define nosocomial infection when there is an increase in the symptoms after 28 hours of being hospitalized and until 14 days after discharge.
What was the etiology of the nosocomial infection? So what was it caused by?
Well, I don't have the exact number of the pathogens, but most of them were viral.
Yeah, it is surprising that malnutrition was such an important contributor. Mm-hmm. Fernando, did you find the same in your studies?
Well, that's a good question. I think we did, but I will look at it in the screen.
Okay.
Definitely.
Yeah, it was surprising. If there are no more questions, thank you very much.
Okay, thank you.